Now to a Target 12 investigators exclusive, the cost of injuries.
We've discovered Rhode Island taxpayers are spending more than $30 million a year on state employees who are out on workers' comp.
And the data we reviewed shows that number has gone up 54% in the last 10 years. Target 12 investigator Tim White is here now with the exclusive details.
State employees who get hurt on the job may be eligible for workers' compensation benefits, which can pay up to 75% of their base salary tax-free. Our research found one group of workers are getting hurt on the job more than any other. In 2009, Rhode Island taxpayers spent $19.7 million on state employee worker compensation benefits. That number has been climbing steadily for years, up to $26.8 million in 2014 to $30.4 million in fiscal 2019. That's up more than $10 million in the last decade.
But we shouldn't see the numbers that we're seeing.
Director of the Department of Administration, Michael DBA, says the $30 million in worker compensation benefits does not include the amount of money the state spends to fill vacant shifts. Those workers are often in 24-hour operations like group homes and are sometimes forced to work overtime.
So this becomes a vicious cycle. If more people are out, we have to have more people do overtime, and the longer we push them and the harder we push them, the more prone they are to break down and have injuries of all different kinds.
Of all state agencies, the Rhode Island Department of Behavioral Health Care, Developmental Disabilities and Hospitals, or BUDA for short, stands out more than any other in the number of employees out on workers' comp. In June, data showed 7% of BUDA employees, or 79 workers, were out injured. Compare that to DCYF at 4% and the Department of Corrections at just 2%. BUDA workers often deal with troubled patients.
We would expect there to be higher incidence of workplace injuries, but we think that the numbers we're seeing there are higher than they should be.
I wouldn't agree with it.
Why is that?
Because I just worked the job and could see how people would get hurt.
Jason Kane has been a community living aide for 20 years, a job where he interacts with developmentally disabled patients. He is also head of the local union for group home employees.
Well, some people are behavioral, they'll act out, they'll attack you. That could be dangerous.
Data shows the median time a BUDA employee is out on workers' comp is 1 year. Nicole Bernard, attorney for Labor Union Council 94, says that time could shrink if the state wasn't so slow to approve medical treatments.
So what could be maybe only 6 months ends up taking a lot longer, at least in the past, and I'm hoping that that number will shrink.
So what's being done? In May, the state outsourced workers' comp benefits to Beacon Mutual. DBA says the insurer has the resources to move the cases along and conduct workplace training to try and reduce the number of injuries.
I'm embarrassed to say that we haven't, as a state, done that as much, and we could have prevented a number of these workplace injuries simply by training our employees or having certain processes with respect to, for example, disruptive patients.
An employee on workers' comp for 2 years can be terminated from their job, but that does not mean the state stops paying them. Right now, there are 315 people who no longer work for the state but are still receiving workers' comp benefits. With the Target 12 investigators, Tim White, Eyewitness News.
Now to a Target 12 investigators exclusive, the cost of injuries.
As we reported live at 5, Rhode Island taxpayers are spending more than $30 million a year on state employees who are out on workers' comp, and that number has been on the rise for over the last decade.
New at 6, we've learned these workers' comp claims often result in lengthy legal battles that can sometimes drag on for years.
Target 12 investigator Tim White is here now with his exclusive findings.
The state agency with the most workers' comp claims for employees hurt on the job is the Department of Behavioral Health Care, Developmental Disabilities and Hospitals, or BUDA for short. Our review of records show hundreds of their on-the-job injury claims wind up in workers' comp court. Target 12 compared the names of every active employee at BUDA with workers' comp court records. Of the more than 1,300 employees at the agency, we found there were 660 workers' comp cases over the years. Some employees had multiple cases, like this worker who claimed a knee and foot injury while loading a food truck. That one claim resulted in 14 separate court cases. The employee was on and off workers' comp for nearly 8 years. Court cases arise when there is a disagreement between the worker and the state.
the courts have their own procedures, and there's a number of protections for employees that can often be challenging for an employer.
The director of the Department of Administration, Michael DeBiase, acknowledges Buda employees have direct contact with often troubled patients at the Eleanor Slater Hospital and one of the 25 state-run group homes, but
we shouldn't see the numbers that we're seeing.
It's things you could do 100 times, and the 101st time you throw you back out doing it.
Jason Kane has been a community living aide at Buda, working in group homes for 2 decades, and he's the president of Local 1293. Recently, the state started offering more light-duty positions to give hurt workers options with the goal of easing them back to their regular job. Kane says the unions supported the idea.
I think most people don't want to be sitting at home doing nothing. It's just not a good feeling.
DBA says the state's workers' comp costs are a major concern and focus, and here's why. In 2009, Rhode Island taxpayers spent $19.7 million on state employee worker compensation benefits. That number has been climbing steadily for years, up to $26.8 million in 2014 to $30.4 million in fiscal 2019. That's up more than $10 million in the last decade.
I wish I did, but I don't have a direct reason about why we're seeing the numbers we're seeing. I just know that we need to address them and get them to come down.
A DOA spokesperson says the longest-running case involves a Secretary of State's employee who was hurt in 1988. As of today, she is still considered an active employee and receives workers' comp payments. With the Target 12 investigators, Tim White, Eyewitness News.
Thank you, Tim. And our exclusive investigation continues right now on WPRI.com.
Target 12 investigator Eli Sherman goes in depth on what the state is doing to shrink the number of employees on workers' comp and how much taxpayers are spending on overtime to fill empty shifts.